Electrocardiography is the process of producing an electrocardiogram. It is a graph of voltage versus time of the electrical activity of the heart using electrodes placed on the skin. The normal electrocardiogram is composed of a P wave, a QRS complex, and a T wave. The P wave is caused by electrical potentials generated when the atria depolarize before atrial contraction begins. The QRS complex represents ventricular depolarization as the depolarization wave spreads through the ventricles. The T wave represents ventricular repolarization. Generally, the T wave exhibits a positive deflection. During depolarization, the normal negative potential inside the fiber reverses and becomes slightly positive inside and negative outside. Before the muscle contraction, depolarization must spread through the muscle to begin the chemical process of muscle contraction. The P wave occurs at the beginning of the contraction of the atria, and the QRS complex of waves occurs at the beginning of contraction of the ventricles. The ventricles remain contracted until after repolarization has occurred, that is, until after the end of the T wave. Atria repolarizes approximately 0.15 seconds after the end of the P wave. This is also approximately when the QRS complex is being recorded in the electrocardiogram. Therefore, the atrial repolarization wave, known as the atrial T wave, is usually obscured by the much larger QRS complex. For this reason, an atrial T wave seldom is observed in the electrocardiogram. The ventricular repolarization wave is the T wave. Ventricular muscle begins to repolarize some of the fibers about 0.20 seconds after the beginning of the depolarization wave. But in many other fibers, it takes as long as 0.35 seconds. Thus, the process of ventricular repolarization extends over a long period, about 0.15 seconds. For this reason, the T wave in the normal electrocardiogram is a prolonged wave, but the voltage of the T wave is considerably less than the voltage of the QRS complex, partly because of its prolonged length. PQ or PR interval. PR interval is the period measured in milliseconds that extends from the beginning of the P wave until the beginning of the QRS complex, is the interval between the beginning of electrical excitation of the atria and the beginning of excitation of the ventricles. QT interval. The QT interval represents the time for both ventricular depolarization and repolarization to occur, and therefore roughly estimates the duration of an average ventricular action potential. This interval can range from 0.20 to 0.40 seconds, depending on heart rate. At high heart rates, ventricular action potentials shorten in duration, which decreases the QT interval. Do not forget to like the video and subscribe to our YouTube channel.